Bismillahirrahmanirrahim. Dear students, Assalamu alaikum. This is Younas Khan and I am here with a new topic, that is sinusitis. We have discussed different parts of the respiratory system, its functions, etc. Now at last the diseases which are caused to the respiratory system will be discussed over here. So during the start we talked about the two kinds of the parts of the respiratory system. One is upper respiratory tract and the other one is lower respiratory tract. So as far as the upper respiratory tract is concerned, it is attacked by two special kind of diseases which are given in your syllabus. One is sinusitis and the other one is otitis media, and rest of the diseases are being caused to the lower respiratory tract. So coming towards the sinusitis, sinusitis is made of two words. There are two words. One is sino and itis. Sino and itis or sinus and itis. The word sino or sinus is a Latin which means a hollow, or which means cavity. Itis is a Greek word that means inflammation. So itis is the inflammation. So this means it is an inflammation of certain special kind of cavities. Which kind of cavities? These cavities are also called as sinuses. The cavities or sinuses are special kind of structures which are found in the facial bones of the, in between the facial bones of the skull. So we can define the sinusitis as it is the inflammation of sinuses. So whenever the sinuses are internally inflamed, this condition results in a special severe attack which is called as sinusitis. So coming towards the different parts of the explanation of the disease sinusitis, but before that, one thing which have to be explained, that is sinus. Sinuses have to be discussed a little bit in detail. Okay, so that you people know about the those cavities or sinuses which are found in our facial bones, and then after that you will be clear about the attack of different kind of germs, etc. on these sinuses and their inflammation. Okay, so sinus is what? I have told you that sinus is, these are special cavities in the facial bones. Special cavities in the facial, in between the facial bones of the skull. Facial bones means whole of the skull is made of two main parts: the cranium, the brain case, and the face bones. So the face bones are also called as facial bones. So this portion is the face along with the forehead. Okay, so these facial bones contains some special kind of cavities which I would like to show them over here. This is a general sketch of the face. This is the nose. This is the forehead. Okay, we will discuss inshallah in support and movement about the different kinds of bones found in our body. Our body is made of 206 bones, so of which the facial bones are 14 in number. So there are 14 bones in the face. These facial bones contains frontal bones, maxilla, the cheek bones. These are maxillary bones. These are maxillary bones. The nasal bones, mandible. Then here is a temporal bone, sphenoid bone, and ethmoid bone, which comes just on the rear side of the eye sockets and the nose. So these bones which are found in the forehead, that is frontal bone, then ethmoid, sphenoid, and the cheek bones, they contain some special kind of the cavities. Okay, so I want to show these cavities with blue color. So this is one of the pair of the bones. There are pairs of sinuses or cavities on either side of the head or face. So means the sinuses are in pair forms. So there is a pair of sinuses in the cheeks, in the cheekbones, or you can say in the zygomatic bones. The cheekbones are also called as zygomatic bones, and these contains very huge cavities. These cavities are called as zygomatic sinuses. Zygomatic sinuses. So one of the pair, there are 4 pairs of the sinuses. One of them is called as zygomatic sinuses. Another one, that is special kind of sinuses, are found in the forehead, in the frontal bone, over here, just here. So these are called as frontal sinuses. These are called as frontal sinuses. And similarly, there are some special kind of cavities which are present in the ethmoid bone, which comes from here just on the rear side, on the back side of the nasal bone, or just inside the eye socket. That is ethmoid bone. So the ethmoid bone contains another kind of the sinuses which are called as ethmoid sinuses. Ethmoid sinuses. And similarly, the sphenoid one, which comes here and just on the back side, it crosses the eye socket or nasal bone, that is just over here. Over here, for example, this is the sphenoid sinuses. So before going further, we can note some of the very important objectives for your entry-test examinations as well. You can note one of the what we can say, one of the objective, that is this about the sinuses. That what is sinus? Sinus is a special cavity found in the facial bones, in between the facial bones. This is one of the what we can say objective. Another objective can be made over here about the number of the sinuses. So there are 4 kinds of the sinuses, and you can also make another objective regarding the position of the sinuses. So the sinuses are in pair forms on either side of the head or on either side of the face. So this is about some of the objectives which can be made by you people, and that can be helpful for you people in the coming entry test classes, entry test examinations. So this is about the 4 kinds of the sinuses. Okay, now further we will a little bit discuss about the function of the sinus. Then after that we will be able to know something about the disease. So what is the main function of the sinus? Why these sinuses are made by Almighty Allah in our body? What is their function? So basically what is there? Basically these sinuses, for example, if we talk about a sinus, a cavity. So sinus is what? It is a cavity in the facial bones which is lined internally by a special membrane called mucosa. It is lined by mucosa. I'm going to talk about the function of the sinus. So it is lined by mucosa, an internal membrane inside the sinus. This mucosa is a membrane that has the ability to release mucus. And mucus is what? It is a lubricating fluid which comes inside the nose, and it helps in the moisturization of the inside of nose. So one of the function is to moisture. It moistures the inside of nose. One of the function of the sinus. Another function of the sinus, one is to moisture the inside of the nose. Another function is to protect the inside of the nose, or to protect the nose from the attack of microbes, dust, or you can say smoke particles, etc. So another function is it prevents the nose, the nose from different microbes, dust, etc. Dust, etc. So it helps to filter the microbes and dust from the inhaling air, and that is then released from the nose, and in this way the nose is prevented from it. So normally the sinus produces, its mucosa produces mucus that perform these kind of functions. So another objective can be made over here, that the sinuses are internally lined by what? Mucosa. Okay, another one, the internal lining or membrane of the sinus produces which kind of secretions? That is mucus. Mucus do what? It moisturizes the inside of the nose, and it also helps to prevent the nose from the attack of the microbes, dust particles, smoke particles, etc. So it prevents the nose from this kind of structure. So these are different kind of objectives which can be made over here in the functions of the sinuses as well. So this is a little bit about the functions of the sinuses. Now what happens to these to the sinuses and their secretions that results in the sinusitis? So normally the mucus is produced whenever these sinuses are attacked by the viruses, bacteria. We discussed it in the causes. So whenever these bacteria, okay, just before that we have to talk about the causes, then we will be able to talk about the sinusitis easily. So causes of the sinusitis, that is what? One is viruses. It can be caused by viruses, it can be caused by bacteria, and it can also be caused by fungi. When infectious viruses sinusitis is caused. Sinusitis is caused in two ways. Either it is infectious or it is caused by the allergens, means different chemicals that cause allergy. Okay, so another objective can be made over here. The sinusitis is of two kinds regarding the causes. One is infectious sinusitis and the other one is the sinusitis caused by the allergens. So if it is infectious sinusitis, then it is 98%. Mostly it is caused by viruses, viral infection. About 2% is caused by the bacteria. It is bacterial infection, and sometimes, rarely, it is caused by fungi. In that case, when the human beings are immunosuppressed humans. So a number of objectives can be made over here again, that what we can say, the sinusitis is caused about 98% by the viruses, about 2% by bacteria, and in those humans which are immunosuppressed, they are attacked by the fungi. So these are the causal agents. In that case, when the sinusitis is infectious, when it is infectious, means infectious sinusitis is caused. Other than that, sometimes it is also caused by allergens, the chemicals that cause allergy. So it is also caused by allergens like smoke, dust, etc. So in this case, the kind of sinusitis is also called as rhinitis. Okay, now one thing which have to be discussed over here about the sinusitis. The sinusitis is what we have discussed, that it is infectious disease. Means it may also be termed as infectious sinusitis. It may also be called as infectious sinusitis, and if it becomes for long times, it is caused for long times, when it becomes chronic. So in that case, this sinusitis may also be called as rhinosinusitis. So another objective, you can note it, that the sinusitis can also be called as rhinosinusitis. In that condition, when it becomes chronic. Okay, so whenever it is caused by allergen, at that time it is called as allergic rhinitis or allergic rhinosinusitis. So these are the causes of the sinusitis. Now we will discuss the mechanism, the way through which the sinusitis is caused. How the sinusitis is caused? The sinusitis is usually caused by the attack of these different kind of microbes. When these microbes attack on the body, when they enter into the sinuses, whether it is zygomatic sinus, ethmoid, sphenoid or frontal. I have told you that there are 4 kinds of sinuses in our face. So whenever the microbes attack on these sinuses, they do what? In the presence of these microbes, the mucus released by the mucosa, that is a little bit what we can say solidified, and they are increased in amount. The mucus is increased in amount and a little bit solidified, as a result of which what happens, these sinuses are filled up with that fluid completely. They are filled up, and as a result, blockage of the sinuses is caused. Blockage of sinuses is caused. So when these sinuses are blocked because of the mucus that fills these sinuses, so this blockage of sinuses results in the cause of the sinusitis. So this is about the mechanism through which the sinusitis is caused, and these are the causes which have been discussed. Okay, now further, the sinusitis have different kinds. There are different types of the sinusitis which have been shown over here. Types of sinusitis. Sinusitis may be acute sinusitis, it may be subacute sinusitis, it may be chronic sinusitis, and it may be recurrent sinusitis. What is meant by acute and chronic? This must be clear. Subacute must be related to the acute. So what is acute and what is chronic? Acute disease or acute problems are those problems which are caused suddenly, very severe, and they last for a very short time. Means just within weeks the disease is disappeared. So if the disease is if the disease attacks on the body suddenly with very severe conditions and it lasts for a very short time, then it is called as acute disease. Or for example, if it is sinusitis, then it is called as acute sinusitis. If you want to know about the chronic condition or chronic disease, so chronic diseases are those diseases which are caused gradually, slowly and gradually there is an increase in the severity with the passage of time, and it lasts for long time, means for months, for years, etc. So whenever gradually the disease is caused, and if it lasts for long time, then it is chronic. And if it is caused suddenly with severe conditions and lasts for a short time, then it is called acute sinusitis. So the types of sinusitis are acute sinusitis, chronic sinusitis, subacute, and recurrent sinusitis. We will discuss about these types. When is it acute? When subacute, chronic, and recurrent. So it is called acute sinusitis when the sinusitis lasts for 4 weeks. When it lasts for 4 weeks, then it is considered as acute sinusitis. When the sinusitis is 4 to 12 weeks, when it lasts for 4 to 12 weeks, means within 4 to 12 weeks it is disappeared and it is covered. So what happens in that condition? It is called subacute sinusitis. It becomes chronic sinusitis when more than 12 weeks are taken by the disease. More than 12 weeks. More than 12 weeks. More than 12 weeks means for months or years. Then it is called as chronic sinusitis. It is also called as recurrent. It may become recurrent sinusitis when the disease attack on the body many times in a year. So when it attacks many times in a year, then it is called as recurrent sinusitis. So again, you can note objectives. One of the objectives is there are 4 kinds of the sinusitis. The acute sinusitis is a disease which lasts for 4 weeks. Subacute sinusitis, another objective, it lasts for 4 to 12 weeks. Another objective about chronic sinusitis, when it lasts for more than 12 weeks, means for months, for years, and if it attacks many times in a year, then it is called as recurrent sinusitis. So these are 4 types of the sinusitis. Now coming towards the symptoms of the sinusitis, how can we identify the condition which is related to sinusitis? So when these symptoms are appeared in the body, we can note it as a sinusitis condition. So the symptoms, one of the symptoms is pain in the facial bones. Mostly pain is caused. Another one, tenderness. Tenderness means whenever you touch the infected area, what happens there? At that time it shows tenderness, it shows pain, it feels pain. So that is called tenderness. Similarly, headache is caused, fever is caused, and sometimes what happens, the secretions are brought into the throat, which causes coughing. So cough is another symptom. Sometimes nausea is caused, means someone feels to vomit. He is not vomiting, he feels to vomit. Then it is called as nausea. And along with that, the mucus is released in the form of nasal discharge. And lastly, a very important symptom, that is what decrease in the ability to smell and taste. The receptors of the smell and taste buds, they lose their function for some time. So whenever there is a decrease in the ability of body to smell or to taste the things, then it may be considered as a sinusitis. So these are the symptoms. Okay, now for the diagnosis, how can we diagnose the sinusitis? So sinusitis is usually diagnosed, it is done by the understanding of the symptoms. Whenever these symptoms are appeared, so any doctor can diagnose it as a sinusitis. Okay, this is one of the way to which you can diagnose sinusitis. Another one is rhinoscopy or nasal endoscopy. What is rhinoscopy or nasal endoscopy? Rhinoscopy or nasal endoscopy is a way or a mechanism to which an endoscope is used, that is brought inside the nasal cavities and sinuses, and through which we examine the nasal cavities and sinuses. So nasal endoscopy or rhinoscopy is a method through which examination of the nasal cavities or sinuses is done, that is called as rhinoscopy or nasal endoscopy. So we can do the diagnosis of the sinusitis with the help of symptoms as well as with the help of rhinoscopy or nasal endoscopy. So whenever the condition or the disease is diagnosed, then there is a turn for the treatment. So how we can treat the condition or the disease, these are the different kinds of treatments which can be done for the sinusitis. So again, I want to say you that these treatments depend upon the kind of the symptom, which kind of symptom, and upon the kind of the causes, which kind of agencies are involved in the cause of the sinusitis. So we can use for the first time nasal sprays, rest. Okay, we can do rest, and as well as well hydration. We must take adequate of fluids in those conditions whenever it is viral infection. If the sinusitis is a viral infection, it is caused by the viruses, so then you can use nasal sprays, rest, and you can take adequate fluids. Adequate intake of fluids must be done. If there is a pain, tenderness and headache as shown in the symptoms, so to reduce the pain, headache, etc., you can use painkillers. So this is another treatment. You can use intranasal corticosteroids. Intranasal corticosteroids can be used in those conditions whenever the allergens are used. In a condition of allergy, if the allergens are attacking on the body to cause sinusitis, then you must use intranasal corticosteroids. If it is a bacterial infection, then you can use the antibiotics. And if the condition is very severe and lasts for many years, for example, if it is very severe and lasts for many years, means if the condition is chronic, if it is chronic sinusitis, so in that case nasal surgery can also be done, and with the help of which the treatment can be done. So this is about the different informations of the first disease of the upper respiratory tract, that is sinusitis. I have mentioned a lot of objectives as well. You can also note more objectives other than those objectives which are mentioned by me. If you people have any questions or problems, you can ask me in comment section. I will try my best to ask. Thank you for till next video. Thank you very much. Allah Hafiz.